Welcome to AM Best Audio.
Plans in the U.S. health insurance segment have seen underwriting profitability impacted by a number of issues, which all factored into AM Best placing a negative outlook on the segment in August 2025. I'm Lori Chortis for AM Best TV, and here to discuss AM Best's annual review and preview report on the health insurance segment is AM Best Director Joseph Zazzera. Joe, welcome. So great to see you. Thank you so much for joining us.
Hi, Lori. How are you?
Doing well. Thank you, Joe. So, Joe, what issues has the health insurance industry been facing?
The past 2 years, starting in 24, the industry's been facing escalating trends. It worsened significantly in 25. And what we were seeing is in fourth quarter of 25 and for the full year, many were reporting that things got significantly worse for the fourth quarter. Most of the industry is reporting underwriting losses, and that's due to higher than expected utilization, acuity, and claims volumes across all the lines of business. That's the commercial segment, Medicare Advantage, and Medicaid. And there are many drivers. It's been a mix. There's been greater inpatient, outpatient, ER, urgent care services that have been rendered. It varies by segment. For example, in the Medicare Advantage senior population, carriers are seeing more surgeries, endoscopies, transplants, life support, musculoskeletal, to give an example. Key drivers for 25 also included pharmaceutical trends. There was rising drug costs, especially in specialty, most notably the GLP-1 drugs, the diabetes and weight loss medications. And we think that that's going to grow further with the introduction of an oral medication option. And some are actually saying they're seeing double-digit escalations in the GLPs. There's also high costs related to oncology and chemo drugs, autoimmune, gene and cell therapy treatments, and then you have the blockbuster $1 million drugs that also have to be covered. So many insurers are reporting double-digit growth from pharma spend. There's also been increase from utilization of behavioral health treatments. That's risen, and it's been high since post-COVID. Things like substance abuse, depression, anxiety-related counseling. On the provider side, there's been provider medical cost inflation, increases in unit cost. And one newer significant trend that many are reporting is the impact of the use of AI, such as ambient listening. And providers are using this to capture additional services when patients are in the office, comorbidities that are discussed, and they use that for additional claims coding. This has contributed greatly to the elevated utilization and claims intensity, and therefore higher claims costs for the.
Customize your data experience. BestLink now offers an interactive company dashboard that provides company-level intelligence in a fast, user-friendly interface featuring interactive tables, charts, and Sparkline performance histories. Customize the dashboard tiles to prioritize the insurer ratings, data, and analytics that best support your workflow. AM Best. Our insight, your advantage.
Industry.
So how are carriers addressing the negative headwinds?
Carriers have been addressing these issues with numerous corrective strategic measures. There's been significant price increases first, and that's in the commercial group, individual, Medicare Advantage, and Medicaid bids that went out in 25. There's been increasing and diverse use of new fee structures for administrative-only ASO business. Management is also addressing the cost structures in their organizations, trying to reduce admin costs. They've been prioritizing membership and revenue growth and more profitable business lines with lower MLR business. There's also been plan design changes and benefit reductions that have been implemented. Some carriers have exited markets, including the nationals. Some of them have exited entire states, and some of the regional or state players have exited counties that they were in. There's been a heavy emphasis on network development, contracting, value-based care relationships with providers. And there's been a heavy focus on utilization management, reduction of lengths of stays and readmissions, for example. There's been an expansion or development of population health programs. And finally, there's been a keen focus on the area I talked about earlier, which is payment integrity. Insurers they want to pay accurate claims, but they want to reduce fraud, waste, and abuse and non-valid claims coding that may occur. So finally, we talked about pharma and how much of an impact that was having. There's a lot of pharma and PBM negotiations that are occurring, and there's a hope that that's going to have a major impact on those costs.
Overall, looking at 2026, Joe, how would you sum up your expectations?
AM Best expects that there will be elevated trends that will continue to remain high during 2026. Moderation is definitely expected. There's an expectation that while companies may still lose money, the losses will be decreased, and there will be some improvement from pricing actions, the plan design changes, the benefit changes, as well as operational efficiencies and cost reduction efforts. And this should contribute to improved results for the industry for 2026. The changes that were made in 2025 plan year and implemented for 2026 should result in more favorable premium levels and operating results across all lines of business. However, there are also regulatory pressures that have been increasing, and the elimination of the subsidies, for instance, for the commercial individual ACA business will impact membership, revenues, and underwriting results, as well as changing the risk pool, which could change, how things turn out for the individual segment. But in summation, will continue to monitor the impact that 2025 corrective strategic action plans have for carriers and the results as we move through 2026.
Joe, so great to see you again. Thank you so much for taking the time to speak with us today. Greatly appreciate it.
Thank you, Lori.
That was Joseph Zazzera, a director at AM Best. To view the full report online, visit ambest.com. For AM Best TV, I'm Lori Chortis.
Looking to get the full attention of the insurance industry? We have the platforms that will do just that. Whether it be AM Best TV, AM Best Audio, Best Review Magazine, or Best Day. Find out more by calling AM Best Advertising Sales at 908-439-2200, extension 5399, and have a great day.